This is Digital Smarts, a common-sense social media primer for interns. This is an overview of some of the potential issues you may face as a resident using social media. We'll start with a little bit on why this is important to understand, then we'll give you a few concrete guidelines that will hopefully keep you safe and out of trouble. My name is Brian Vardabedian. I'm a pediatric gastroenterologist and staff physician at Texas Children's Hospital, Baylor College of Medicine in Houston, Texas. I blog at 33charts.com. With me is Joey Spinner, second-year pediatric resident at Texas Children's Hospital, Baylor College of Medicine in Houston, the finest pediatric residency in the United States. In medicine, we're in a funny place. You're part of an army of digital natives entering a world totally unprepared for the way you communicate. But in your lifetime, this will change, and there will be growing pains. What's really exciting is that you, as the next generation of physician, will help establish these standards.
As a physician, you're different. What you do is different, and you're held to a higher standard. You are no longer a medical student. You are a doctor. You are a professional and represent the hospitals and institutions where you work and treat patients. More is expected of you. You have a digital footprint, and it's now the footprint of a doctor. Understand that everything we record, write, and post becomes part of a searchable trail that will digitally define you. Your patients will judge you. Patients will Google you and look for you on Facebook and Twitter. How you look and the way you present yourself will define how people perceive you. You are an ambassador for your residency and hospital. Beyond looking after your own reputation, you're now a representative of the hospital with everything you say and upload. So we've come up with 9 basic guidelines to keep in mind and hopefully keep you safe. Avoid patient-specific dialogue and comments on sites like Facebook and Twitter. Why? Because your patient's business is no one else's business. Federal law prohibits the disclosure of patient-specific information through HIPAA. So, if we work to be HIPAA compliant, we're off the hook then, right? Consider that I'm on a service and see a really interesting case of neonatal hemochromatosis in the neonatal ICU. So, I decide to share on Twitter. Anyone see any problems with this? We can argue that this doesn't violate HIPAA and is, in turn, safe. But what if the patient happens to follow me and makes the connection that it's her baby that's being discussed? I suspect that a lot of patients would have a problem with this. Potentially, this sort of ambient documentation represents a breach of trust. Call it a HIPAA-compliant breach of trust. Remember that our moral obligation to the relationship we share with our patients goes beyond legislation. We are way worse in the elevator than we are online. Keep in mind that the rules haven't changed. Remember that despite what new tools appear, our standards of privacy don't change. We just need to pay more attention to them. PRIP. But of course, we discuss cases in clinical conferences and sometimes in physician-only communities where we are still obligated to protect the privacy and dignity of our patients. Any dialogue you have concerning your clinical experiences should pass the PRIP test. Privacy. Have you removed patient identifiers? Respect. Does your communication reflect respect for the patient under discussion? Intent. What's the intent of using the case or illustration? Is it intended to amuse others at the patient's expense or to educate? Perception. How will the discussion be perceived? If the patient were listening in or could read what you've written, how would they feel? If you look at many of the problems arising from doctors using social media, you'll see that those involving patients usually involve one of these 4 points. They're your patients, not your friends. While the issue of friending patients in social spaces is controversial, it's probably a practice best avoided for now. Keep in mind that the separation of your personal and professional life is going to become increasingly difficult to separate, and assume that any picture or comment that you post on your personal Facebook page can be copied or grabbed. And remember, what happens on Twitter stays on Twitter. because everything that we record becomes part of our digital footprint. Once it's out there, it's hard to take it back.
You know what keeps me honest when publishing to my blog? The idea that my division chief, chairman, colleagues, and mother-in-law are reading. The greatest litmus is social peer review. And the point here is that we should always be thinking about who's looking. This won't always save you, but it's a start. And if you think you can be safe by using a pseudonym, think again. Remember that you can always be found, so be careful. And be careful taking pictures in the clinical setting. Remember that there can be patients in the background. Remember that perception trumps reality. Remember that what patients and your superiors perceive may be as important as what's occurred. If a patient believes that your social dialogue or your use of your smartphone happens at the expense of their care, that's a problem. So if you have downtime in your continuity clinic and you decide to jump onto Twitter, Facebook, or YouTube, think about how that might be perceived by patients. Exercise medical mindfulness. And remember that patients and colleagues may not understand what you're doing with that iPhone or tablet on rounds or in the clinic. While you may be looking up a drug contraindication on Hippocrates, your patient may think that you're posting a status update at their expense. This is the smartphone attribution error. People think you're doing one thing with the phone, but you're actually doing another. So be medically mindful. Almost universally, when speaking to doctors, social media is seen from the perspective of risk, and almost never is it viewed from the position of opportunity. While clearly we need to mitigate the risks involved in public dialogue, we need to recognize the remarkable opportunity we have with these new media. Medicine and the world around us is changing very quickly. How we respond to these changes will define our profession over the next generation.